So what sort of challenges did you have in the recovery period? Any major problems, or how did it?
No major problems, no. I was more fatigued than I thought that I would be. The first week I rested. I just stayed in bed mostly. I could get around. I could get around pretty easily actually, but I was just very tired. And then I was only out of work for 1 week, and I went back to work the following week and was able to work just fine, but I did feel tired. That was the only thing.
So some things we tell patients is that for every hour you're under anesthesia, you don't quite feel good for that week. So if your surgery was about 3 hours long, then for about 3 weeks, patients are typically still trying to get back to their own physiology.
That actually
If that's accurate?
Yes,
Okay,
very,
good.
yeah.
I take it you had 2 drains.
I had 2 drains.
How did you manage those?
Just fine. They didn't bother me. I had help at home, which was really nice. I think that that was very helpful. I think it'd be difficult to manage the drains and the measuring and the pain medication and everything sort of by yourself.
So that's a good question. So how was the pain?
Manageable, really. I mean, I did take the medicine that was prescribed, the pain medicine that was prescribed for the amount of time that I had it. And then after that, I just switched to Advil. And I needed that for a while, actually. For about a month, I would take Advil on a pretty regular basis. But then that was all I needed. I was done.
And then we'll tell patients typically the breast might feel a little higher and fuller and more swollen initially for about 6 weeks. And then in most cases, by 3 months, you're starting to get the normal shape that we're looking for.
That's exactly what happened to me. Yeah, they were high, they were tight, they were full. And then they just sort of started to relax and become more normal. Yeah.
Good. Now that you're about 5 months, would you have it done again?
Oh, 100%, 100%, 100%. I recommended it to all my friends. All my friends say, "What was it like? What was it like?" And I say, "It's the best decision I've ever made."
Excellent. Anything else you want to tell me or my staff? I mean, one of my best caretakers is filming right now.
Thank you.
So
You guys have been awesome.
Sarah's my right-hand woman person, my manager, and
Yeah.
she does a lot of the discussion of patients beforehand and after, and she's sort of behind the scenes, but she really is part of the process.
No, Sarah's been great. She was able to talk me through everything from beginning to end, everything that I would expect, the bras that I would need to buy, sort of the process. And one time I did have a little bit of a concern. The tape that I was wearing caused a little bit of redness and irritation. And I called Sarah and asked her about it, and she asked me to send her some pictures, and I did, and she was able to talk me through and just say, stop using the tape for a little while. And I think that's all you need to do, because I was nervous about it, but she'd seen it all before, and it was fine.
Perfect. All right, so very good. We'll stop there and